Hello guys, welcome back to my YouTube channel. After a long time, I'm going to upload a video. I'm really sorry for such a long gap. I was not able to upload the video due to some personal reasons. So now I will try to be regular in this. So from now, I am going to start a new series of video in which I will discuss about clinical research. So let's start a new series of video. I hope it will helpful for you all. Generally, clinical research is defined as research on human volunteers designed to test and license products such as drugs, vaccines, or devices for prevention, treatment, or management of various diseases. Nowadays, there is a wide acceptance of evidence based medicine. In short, we call this EBM. It means integrating one's best clinical expertise and experience into best available clinical evidence obtained via systematic research. Basically, clinical research is a broad based discipline and has many ramifications. Overall, the process may involve several steps. The main aim of clinical research is to generate clinically meaningful data for diagnosis and prevention of disease. Doing research ethically is very important and hold the key to successful completion of research project. There is Indian guidelines which is available for people working in clinical research. Clinical research is divided in two parts: discovery and development. Discovery leads to latest diagnostic method and medical devices, while development leads to existing drugs and devices. These both subgroups have one major role, which is treat, prevent, and cure disease, betterment of human health, and quality of life. Clinical research is done in two major manners. First, observational, and second, experimental. It is also known as clinical trials. So, observational include trials of characterization of disease, trials to know the cause of disease and identify a potential clinical therapy, while experimental contain the identify clinical risk and benefit of treatment option. Clinical research studies divided in two parts: observational and experimental. Observational is subdivided into descriptive and analytical. There are many subgroups of descriptive, analytical, and experimental, which is shown in diagram. Now we talk about the process of clinical research. Clinical research is divided in four parts: preclinical testing, which is also known as R&D, research and development; clinical R&D, NDA review, and post marketing surveillance. The preclinical testing is range for 1 to 3 years, average 18 months. This is initial synthesis and included in phase 1. In this, animal testing also occurs, which is for short term. The second one is clinical R&D, which ranges 2 to 10 year, average 5 year. This is the second phase. And from preclinical testing and clinical testing, animal testing occurs for long time. The third category is NDA review and the fourth category is post marketing surveillance. The NDA review and post marketing surveillance both take 2 to 2 months to 10 years, average 2 years, and post marketing surveillance include adverse reaction reporting, surveillance, sample testing, and inspections. Now, types of clinical research. There are two types of clinical research: preventive research and treatment research. Preventive research contain reduce the risk of disease. Example: cessation of smoking reduce risk of lung cancer, and other is using HPV vaccine to prevent cervical cancer. The second one is treatment research. treating a disease using a known modality and comparing it with modality to be tested. Example, comparing enalapril to a new antihypertensive. The second is using HAART and treating HIV. HAART stands for highly active antiretroviral therapy. It comprised of combination of 3 or more antiretroviral drug. Antiretroviral drug is a combination of drug that suppress the HIV replication. So there is no research which is free from the bias. It is important to learn about bias right from beginning. So research bias is reduced by basically four processes. First, randomization. Second, blinding. Third, consistent outcome assessment. And fourth, good flow up. Randomization include treated and untreated group are similar in all aspects except treatment. This is done to make sure that outcome difference can occur due to treatment only and not due to factors like age, sex, race, smoking, alcohol, education and other factors. Second, blinding. Blinding is the process by which secrecy about the drug treatment is maintained between the investigator and the participant. Opposite of blind trial is called as open label trial. Third, consistent outcome assessment. At every important stage of clinical trial, the outcome assessment should be outlined. Fourth is good flow up. Must to know mortality, to know about compliance and non-compliance. Third one is if patients are healthy or are sick. In short, basically clinical research deal with research on human volunteers which are compared with patients who have disease. Not only drug but also devices can be tested in this manner. This is all about clinical research and this is the first video about clinical research. I'll try to make a series of video. I hope this is helpful for you. Thank you.